Hey, I'm Onnie Michalsky, and I'm the owner of Yellowstone County Mental Health Alliance. We serve the mental health workforce here in Montana, and I'm looking forward today to sharing more about our company and I'm looking for some community partnerships.
With no further ado, give it up for Onnie Michalsky.
All right, as Leif had shared, my name is Onnie Michalsky. I am a licensed clinical professional counselor here in Billings. I have my own practice. And today I'm presenting about the Yellowstone County Mental Health Alliance, which I presented back in June or July of last year. So some of you may have been to that presentation. But today I'm going to share about our updates. And we've done a lot in the last 9 months. So if this is the first time you're hearing about the Alliance, I'm just going to give a very brief overview. It started out somebody asking in a Facebook group if there was a group for providers here in Billings. At that time, there wasn't. So we decided to start one. We started meeting at Mazavo's on a Saturday afternoon. And then we eventually moved to, our first one had 15 people. So we knew we were onto something. And then we moved to the Community Foundation building, and on Wednesday afternoon, at noon, the second Wednesday of the month, and that's where we've been meeting ever since. So we have 3 core pillars of the Alliance. The first one is our monthly in-person meetups. We bring in speakers who are referral sources or people who are offering a service that we think our clients would use. It is open to licensed and pre-licensed clinicians, as well as anyone in the mental health space. So this is wellness professionals, people in the recovery world, agency workers, private practice owners, anyone who is serving clients who are seeking mental health help. I've also been able to offer a continuing education credit for anyone who attends. And then our second one, which we were kind of talking about during the last presentation, is our virtual membership. We launched this back in October, and it started as just pure consultation because we had a couple minutes at the end of one of our in-person meetups, and one of the clinicians asked to staff a case. There was such great feedback that I decided to launch a virtual membership that included the pure consultation. But we also do, and this is open to clinicians as well as what we call allied professionals, so other people who are in the field but not necessarily licensed or pre-licensed. We also have a book club on like leadership and books of that sort, of that genre, self-help books, that kind of thing. We have think tanks where we brainstorm about finances and marketing and all the other things that it takes to run a business. And then we also, tomorrow night, we're hosting a virtual speed networking event. Super excited about it. And that will be an opportunity for people to network and really get to know who do you want to be referred to? Like, who is your ideal client? And then finally, as Leif shared, we're holding a conference. This is our inaugural conference happening May 21st and 22nd. We rented out the Billings Hotel and Convention Center. We have over 25 plus speakers and lots of different sponsors. Billings Clinic just hopped on board. We have Montana Psychiatry. We have just people, not even just in the state, but nationwide that have reached out to us about being an exhibitor or being sponsoring the event. So that has been blowing up beyond my wildest expectations, and super excited about that. And that is open to mental health providers, licensed, pre-licensed, but also anyone in the mental health space that wants to come and learn about the innovations and treatments happening. I also became an approved continuing education provider so that we can offer, at this point, it's 11 CEUs for that 2-day event. So some things that we've done so far. See, I have a 2-minute warning. So we've grown a Facebook group of over about 500 members. Our monthly in-person meetups are about 25 people on average. We've gotten a lot of partnerships with local community business, the continuing education through the meetups. I've become affiliate partners with different continuing education providers like PESI, and also one-off trainings. We are growing our email list. The Alliance Circle now this says 21, but as of today, this morning, we have 26 members of the circle, so that's growing. Growing online directory, Bridging the Gaps conference, May 21st and 22nd, and we're also I've had to expand the team because I cannot do all this by myself. These are some ways that we have partnered with the community. At our meetups, we've got speakers, we've got lunch sponsors because we meet at noon, so we wanted a way to serve those who are coming. So we've partnered with different companies and organizations, sometimes the speakers themselves, who have come and sponsored our lunches. In our newsletter and website, we have sponsors, like regular sponsors, who have put money forth, and we advertise for them, basically. The membership piece. And then in our conference, we've got the sponsors, the exhibitors, the attendees, and the corporate sponsors that have stepped up to partner with us. So this is the way that you can connect with me and the Mental Health Alliance. And our meetup is actually today, if you're interested in coming, at noon. All right.
And Dr. Thomas Keogh is going to be here.
Yes.
Chiropractor is going to be there today.
Their chiropractic is coming with the mental health connection between chiropractic care and mental health.
One of the questions I'll start off with, because I'm an allied member, so I work in the mental health space. I'm not a clinician, thank God. I'm sure everybody's glad about that. But there's still ways that you can fit in and be of service. Give us some examples of some other allied members and some of the things that they might do in the community. Because I know several of them are here.
There's actually, I was just going to say, Danielle is here. She's also going to be our MC for the conference. Heather is here, and she is an allied member. Trish is an allied member. So they can participate in any of the events. They can come, and they are a great referral source because all the time, in fact, I am to Resilient Stories events, I'm always telling my clients, like, hey, this is a way to get connected to the community. And so being connected with the providers, because of the people who are not necessarily doing therapy, they need to be able to have people that they can refer to that they actually know and trust.
Sure.
I mean, we can all go on Google and say, oh yeah, I'll help you find a counselor. But if you are actually knowing them and trusting them and getting to know them, then it's a much more trustworthy referral.
Questions?
Hi. Do you want to tell everybody kind of a quick run through of the conference, maybe like what they can expect, how much tickets are?
Yeah, so right now it's early bird. The early bird tickets are on sale, $325, and then it goes up on May 23rd, or not May 23rd, March 23rd. We'll go up to the regular price. 2 full days, 7:30 to like 4:30. We've got a social happening on Thursday night. We've got some really fun sessions that I'm excited about. We have an experiential session where Carol Penn she's leading Qigong. I did breath work about a year ago. Never would have recommended it for my clients, but I did it and I loved it. And now I recommend it to my clients who I think would enjoy it or benefit from it. So I wanted other providers to get that experience of these other modalities of what that is like so that they can recommend it to their clients. So we have breath work, sound bathing, and Qigong, like breath as movement. We also have roundtable session, which is a fun, quick 25-minute discussion where everybody rotates to small group discussions based on lots of different topics. And then, lunch is catered both days, so lunch is included. Like I said, it's at the Billings Hotel and Convention Center. We rented out 4 big rooms for all the different speakers that you get to choose from each hour. And
how many speakers do you have on?
Over 25.
Wow.
Yeah.
That's impressive. Yeah. I think show me that clip.
Yeah, this is been excited to learn more about this and to see what you're doing. And I know the conference is like the immediate goal that you have. What's your vision for the membership and the community that you're building? Is this, and I don't know the answer to this. If you're certified in Montana, does that mean that you're certified to serve people from other states?
So,
is this a, what's your vision for expanding it?
Oh, I have a big one. Okay. So
great. Tell me about it.
I actually own the Montana Mental Health Alliance, this is just kind of a branch of it. So eventually, the Montana Mental Health Alliance will be the umbrella, and I will do different branches, like the Gallatin Valley Mental Health Alliance, the Eastern Montana Mental Health Alliance, as a way to connect providers. We're not serving clients directly. We're supporting the mental health workforce. So the Yellowstone County Mental Health Alliance will just be one almost like franchise under that big umbrella. The membership is open to all of people in Montana. So right now we have one or two from Bozeman, another from Missoula. One actually lives in Florida, and she is just licensed in Montana. So it is for people who are serving people in Montana, not necessarily just Yellowstone County. The conference is like hosted by the Yellowstone County Mental Health Alliance. Probably for the next few years, we will be hosting it because why not? We're the biggest city in Montana. We've got the infrastructure already in place, hotels, restaurants, all of the things. I want to increase like the tourism piece, and we've also partnered with Visit Billings, and we're even having the mayor come do a welcome address at the thing at our conference. So that's my bigger vision that I'm moving towards.
Next question. Go ahead, Emily.
You have grown so much since you were here before,
Yes.
so fast. Congratulations. Talk a little bit about the challenges with the model. Like, how has the growth, has it been challenging to grow this quickly, this fast? What are some of the things that have worked really well? What are things that you've tried that you had to change? And what are currently, are you struggling with or challenged with?
I would say people power is my biggest. I've had to bring on an admin assistant who is here, and also I hired a marketing person for the just to handle the conference itself, and an conference operations person. I have just different people in place, contractors and employees that I'm trying to just kind of delegate. That has been my biggest challenge because I am such a doer. And I am a workaholic. You could ask my daughter. I'm always like, wait, one more email. I hopped out of bed last night. I'm like, I have to add about the parking for today's thing in our newsletter already scheduled. So really just learning to delegate has been my biggest challenge. And my vision, communicating my vision to those people who are on the team and even throughout the community of this is bigger. This is my counselor yesterday. I was telling Jason every week, when I'm the client, I go and I'm the woes of all the things that it takes to run a business. And yesterday she got permission that she's in a group practice that they were all going to come to the conference. And she's like, I went online. She's like, and holy smokes, I know that you were doing this, but I didn't realize all that you've been doing. I know, I've been telling you, that's why I need to hire people. It has just been it's been growing so much and it's so exciting, but I just have to learn to delegate and not do it all myself.
Well, I think it's important to note too, Onnie, that you still run your practice.
I do.
You still work all day,
Boundaries.
every day, right? So tell us a little bit about what you do there, what population you serve.
So Moms Without Capes, I presented at 1 Million Cups back in 2021, I think, or 2022 about Moms Without Capes. That is my mental health practice. I do in-person and virtual. I have a few interns that are also seeing clients, not necessarily moms, but boundaries is how I do that because I keep my caseload. I see about 10 is max, and I just go all in with them, but I refer out, which is why the Alliance helps so much because I've been able to meet trustworthy therapists to be able to refer, and also other events and things. The moms that I work with are moms who aren't making space for themselves, and they are just burdened by a really heavy mental load. They struggle with delegating as well. A lot of them ADHD and doing all the things and all of that. So being able to partner with different people and different events and knowing what's out in the community, I can encourage them and we can work towards connecting and getting friends and taking themselves off the shelf.
Here's a question for you. We all know that mental health is uber important, especially in rural Montana where we're isolated, right? And we have a lot of farm and ag community. What do you think are the biggest hurdles or roadblocks as to why people won't reach out to get the help they need?
Yeah, I think places like back east, they have waiting lists out the butt. But here, I think people are still struggling with that, asking for help, recognizing that mental health is a thing, that they are, that help is available. But there is hardly any waiting list. Some people do have waiting lists, but really they don't. Like, there is the help available, but we don't know. Like, you've got to take that first step. So I think there's just that mentality that exists, as well as that fear, or you might have had a bad experience. It is so important that you click with your therapist. So if you went and you're like, that didn't help me, I encourage you to try again, because it just may not have been a good fit. You have to build that rapport. And there's so many different modalities and different ways to do therapy. It just may not have been a good fit for you. So try again.
Heather Estes, everybody.
I know that you have done a lot of work and collaborated with different nonprofits locally, and there are a lot of nonprofits that utilize mental health services. So I was just curious if you have a specific strategy in mind to collaborate with nonprofits that are maybe even some of the clients that your members are serving.
Yes. I don't have any strategy. To be honest, I just don't. That's, again, it's one part of I'm only one person, and I'm trying to figure out okay, what is our vision? So I am trying to build a team that has also this vision of if that is your skill or that is what you want to bring to the table, let's talk, because I am just one person and I can only do so much.
How many podcasts do you have out with Moms Without Kids?
260.
260.
Yep.
Oh, that is amazing.
Yeah, that's another part of my vision.
Do you plan to add that?
Thank you for asking. Yes. I've done the Moms Without Capes podcast since 2021, I think, is when I started that. 4 years, 260 episodes. But then I started the Alliance in 2023 and kind of leaned towards that. And Moms Without Capes took a back seat. So I wasn't feeling as passionate about it as I had been, and I just felt like that wasn't doing any service to the people who are listening. So I decided, it was a hard decision because I really enjoyed podcasting and being a podcaster and all of that, but made the decision to end that in December of 2025. So it just ended, but even before I ended that, I really liked podcasting. So my plan is to start the Mental Health Alliance, starting with interviewing our monthly speakers and sponsors, partnering with them to be able to sponsor the podcast. I want to do it differently than Moms Without Capes. I have some other ideas, but that is eventually something. But with the conference happening, I'm I just don't have the bandwidth right now to make that leap and start that, because I really want this conference to be amazing.
I was thinking that could be 25 podcasts.
It could be. It absolutely could be. And that might be a way to continue past the conference. Yeah.
Hi. A couple of questions, a little simpler. You mentioned the sponsorships. Is it, are the sponsors all in the mental health world, or could it be anybody?
No.
Everybody? Okay.
Actually, one of the companies that had reached out to us to sponsor was ABA Law. And they're one of our tiered sponsors. So one of our higher level sponsors. And they don't have anything. They're injury lawyers. So they reached out to sponsor us, and they're not in the mental health space. They don't even plan on doing having an exhibit or being an exhibitor or anything. In fact, their tier included a complimentary registration, and they're we don't have anyone on staff that would benefit from this. So we went ahead and created a scholarship of this will be a scholarship presented, or not presented, but sponsored by the ABA Law group, to be able to sponsor an attendee. So no, you do not have to be.
Hi, so maybe you answered this already, but are there resources for veterans in this community?
We have, so the resources are for the mental health providers, not necessarily for the clients, not for vets. That would be another kind of with the nonprofit, another arm that if somebody was willing and wanted to step up, we can make a position for you that you would be in charge of creating that space, or providing services for those who are serving veterans. But as of now, like it's kind of just in the whole community. Like there may be counselors that are serving veterans. Come join our membership. Come to our monthly meetups. So there's nothing specific for people serving veterans.
Sure, you know.
Hey,
Yes, sir.
first of all, you're fabulous, Onnie. Thank you so much for all you do, you brilliant, lovely woman. You are in a room full of connectors. As I look around here, so many of us wear so many hats. So thinking about your conference, your Mental Health Alliance, the groups of people that you're working with, what are some out-of-the-box people we should be inviting to collaborate with you we might not think of? For example, in my little world, I think of all of the cancer patients we serve.
Yeah. It's a hard question. It's a hard question to think of. Yeah, like on the spur. I don't know what. So you're thinking? Is anyone else thinking of anyone that I'm not being like I'm not able to think of right now? Like out of box connections, people that I should be connecting with.
So there's the RHTP grant, right? Rural Health and Transformation Project, I think it is. And I was just thinking in my head, like, how can you be a resource, either with the nonprofits, because you're not a nonprofit, but they're going to be distributing all that money to nonprofits. So if there was a way you could kind of partner with some of them and also your providers, those that are open to, receiving counseling and therapy, they're probably part of that group as well. So I'm just thinking like what Sherry was saying, what my head does when you're talking about that, but the RHTP grant would be probably beneficial for your providers and any nonprofit connections.
Yeah, and it really is about connecting providers with what they need and to better serve their people. So
why don't we talk about BCF at some point in time, maybe a foundation or a nonprofit arm, even to your organization potentially. Not trying to give you another role to do.
No, I know, but I've had people reach out to me, like clients who are seeking services, and they're like, hey, I need a counselor for so-and-so. And at this point, I just turn to my circle members and I'm like, okay, who serves this particular person with this particular problem, and really just kind of match.comming it to help them connect. But people are reaching out to me. Like, that is a lot of time that I need to have something automated. I need to put a system in place so that I'm not the one who's doing that. And the match counselor match actually was already.
That's called an alliance.
It was already created.
Right
Somebody already owns it.
So kind of calling back to Leigh's question earlier, I'm pretty passionate about people addressing their mental health and trying to make that safe for people. Mm-hmm. That problem plus my personality just means that I obnoxiously encourage people to do that. Is there a more helpful script? What do you find with people that had a hard time with the stigma around mental health? What kind of stories do they have for like, oh, this is what actually made it okay for me to engage mental health services?
So do I hear, like, what I think you're asking is when somebody needs help, is there a script that says,
You encourage people to seek mental health and kind of make that stigma. Is there anything that I can do to make that safe for people, make that less? Make it more safe for particularly men in the Western United States, like we think of getting help.
Yeah. So like it's like you really need to talk to someone kind of thing. Well, I think engaging in some just simple reflective listening, kind of understanding, providing that safe space for them, maybe sharing about your own, not making the story about yourself, but saying like, hey, I was struggling with something similar and I had sought help and it really helped me do ... And it may just take patience. Like they might not be ready to go right then and there and sign up with your counselor or anyone, but just being that safe space for them and providing some resources for them, would be the best. Sorry, that's all I have.
How about your next slide? I think you have it ready.
Oh yeah.
The $1 million question.
Nope, it's back. So who in your network should I be talking about becoming a community partner? That's my question.
Great. Great job. Thank you. That's wonderful.